Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And we are back, and we are going to be having our first conversation. We are having our COVID-19 update with the Ministry of Health. We have joining us this morning to give us our update the Director of Health Services with the Ministry, Dr. Marvin Manzanero. Good morning, Dr. Manzanero. Thanks for joining us.
Good morning.
So, Dr. Manzanero, is it good news that we'll be hearing this morning on our COVID-19 update?
Well, in terms of where we are in Belize, I think still are relatively good. We are now day 36 since we had our last 4 cases reported. What, however, isn't necessarily good news is what's happening in the region. We're monitoring very closely what's happening in neighboring countries. And we know that Guatemala continues to have increases. I believe they are now above 2,000 cases. They are going up rather quickly. Mexico is also now continuing to increase. And I saw projections last night that they are taking it that they probably won't peak till July. They had initially said the end of May, then they said the end of June, and now it seems it's going to be in July.
Really?
So that's
Mexico, you said?
Mexico, but as I said, Guatemala is also increasing, Honduras is increasing, El Salvador is increasing, and we are getting notes that Nicaragua may actually be increasing, although we are not seeing those numbers being reflected.
Yeah. Now, when you talk of thousands in numbers of confirmed cases of COVID-19 in places like Mexico and Guatemala, how do you put it into perspective given their population sizes? You're talking millions of people in these places.
Yeah, that's always the note you have to look out for. But what you look for is also how quickly your cases increase. So if you go from 1 to 2, if you go from 200 to 400 in 2-3 days, regardless of the population, if you're doubling the rate at which you have your infection, then that's a serious concern. And that's what we are noticing in Guatemala. We are noticing in Mexico. We are noticing also that Mexico is seemingly not being able to keep up with the testing, so that they are having people dying and they are just being diagnosed as atypical pneumonia, so that in point of fact, the numbers could be much higher than what they're reporting.
So they're not, their testing protocol isn't able to cover everyone? Is that the problem?
It might be the issue of reagents, and also you will recall that we are still following the gold standard, which means you cannot be doing rapid testing. Not every lab may have access to doing the actual testing. And again, just because they are also a big country, you have to note that they will not have the ability to test everywhere. For us, it's quicker to get a sample to central medical lab. I mean, the most is 4 hours, and you can have a result in 8-12 hours. But if in rural communities in Mexico you are not able to process your sample rather quickly, then it can be a rather difficult situation.
And have there been, sort of explanations for the sharp rises in our neighboring countries?
Well, that's what had been anticipated. Having issues with waves. I mean, you will notice that most countries are not taking the rather drastic measures we took in terms of locking down. As is in Mexico, they're opening up their economy this past week. So even though the numbers continue to increase, they are also looking at the economy situation. We know some states have the autonomy to actually open back their schools, and that's a decision that they are taking. Same thing in Guatemala. We had not seen a severe lockdown until this past weekend, but then we saw the reports yesterday that people just went back practically to doing their normal activities just yesterday.
Now, you started off by saying that this puts us in a precarious position because they are close neighbors, and we know that we have a lot of families that tend to travel back and forth quite often and not always through official border settings. Is there any kind of surveillance that has been created by the Ministry of Health to look at border communities closely over the next month or two, especially given the fact that you won't be able to watch 24/7 whether or not somebody goes over the border despite the restrictions?
Yeah, we have some informal dialogue with some of the communities, and I know there's an attempt to try to establish a more fluid communication with communities on the north and the west, because what happens is, you are right, it's the illegal entries that can get you into trouble, particularly because people are trying to hide from official sources. So even if they are ill, they probably are not going to be forthcoming to the communities, to the health system, because they will not want to say where they have been.
Yeah.
The legal crossings, I think, are much easier to handle, and that's part of the undertaking we are trying to do now with bringing back Belizeans in a more orderly kind of fashion. But the legal entries can be the trouble for us.
Has there
I know
been
presence
targeted public health messages in these border communities, maybe telling community members to be vigilant, to report cases, because they would be the first impacted if somebody goes across the border and contracts the virus and comes back to the village?
Yeah, that's ongoing, and what we're also trying to do is try to see if we can reach out to the community leaders to see if they can be the focal points in these communities, because we understand that, I mean, there are many things that they probably won't tell the authorities, but we are banking on perhaps them being able to tell us where the situation is kind of brewing and escalating. So I think we have made some progress in that light in the north, but it can be a difficult situation indeed. So what we try to do is have a controlled kind of mechanism, which is trying to get people like the Belizeans that are trapped across the border or all over in an orderly fashion back home.
Is that what the ministry is working on right now, the repatriation, and how to do so safely?
Yeah, that's being coordinated with Immigration and Ministry of Foreign Affairs. We have that already plan set in place in terms of what will happen once they start arriving. We want to do it in an orderly kind of fashion. We don't want everybody to come at the same time, because so the first undertaking is trying to get a census. That's the reason why people are asked to fill a form. They will be able to come and where they actually live, because for now the only entry points would seem to be the northern and western border, but most of the flow is actually coming to the northern border station. So that's where we anticipate we're going to be having a higher number. One of the plans is to see if we can move people not only to Orange Walk, but also to Belize City, which is where we have the bigger hotels where people can stay.
Now, Dr. Manzanero, what is the safest way to do this? Because when, as outsiders looking in, you think of people all traveling to Cancun and then most likely having to bus their way back to Belize City. The level of exposure in a country that is, as you clearly stated before, doubling its cases. I mean, what really is the safest way to do this?
Well, this is, recall when we were having people traveling back from Europe, from the US, being in a plane, being in a bus puts you at a higher risk, obviously. So you have to take the necessary precautions when you're coming back. That's why we want to do it in a planned and structured way, so that we are able to give people specific recommendations on their way back. Upon arrival, the intention is to have somebody from health screen them. If they are not having any kind of symptom, then they would go through the process of going through immigration, customs, wherever it is that they have to do, and have some means of transportation to the quarantine facility. Because the question is always how much contact is an immigration customs officer going to be having. Well, it's minimal. If the immigration customs officers are not having that much interaction other than getting your passport, whatever stamp, you follow the process. We would not be screening people with a test upon arrival.
I was going to ask that. They won't be tested when they arrive?
Not unless you have a sign or symptom. And we have had this discussion in the region to see how we would do it and how other countries are doing it. And it doesn't really make sense to swab arrival if you're still going to go to a quarantine facility, because we're going to assume you're negative. When will we swab you is at day 14 when you're ready to come out. Because if you are negative, then you are free to go. But because if I swab you and you're negative, you're still going to go to a quarantine facility. So you might just not be doing anything with doing a test upon arrival.
Okay, so
You
they will
will
all
also
be
be
tested,
screened-
but just
also
not
be
at the
screened-
point of entering.
Not
Sorry?
at the point of entry. At day 14,
Okay.
or if you develop sign or symptom before day 14, then you would be swabbed.
Okay. So what happens if someone is symptomatic when they arrive at the border?
You are swabbed, you will be placed in the quarantine facility upon arrival, or not be asked to move. I mean, if you're coming on the way to Orange Walk or Belize City, then you can't move until we have determined your result. If you're positive, then that becomes your day 1 of 21, because then that changes. Same thing with anybody who's coming to our facility. If you are going to, if we swab you at day 14 and that's when you turn out positive, that becomes your day 1 of 21. That's a different situation there.
Now, a big part of the quarantine for people returning home is that currently they're being asked to cover the cost of their 14-day quarantine. Early in the conversation about this pandemic, I know the ministry was working, I believe along with NEMO, to set up some quarantine areas. You know, are there spaces available for people who cannot afford to pay $150 a day? I think that's the number they quoted, which amounts to almost $2,000 for 14 days.
Yeah, well, the facilities we had looked at was IT vet. Remember, these are not people necessarily who are thinking of coming from outside. Those are actually being used now for people who have jumped the border illegally. There are options available, but that might not be the best option in terms of if you're coming back from traveling. I know it's a difficult situation in terms of the economy, but we have to find a mechanism to ensure that we are also not being burdened to a certain extent with the cost, because we understand that the amount of Belizeans that are out there is rather significant. So we do have the quarantine facilities. For example, in San Ignacio, there's 5 people that I know of, and those are the 5 people caught illegally crossing the border. There are some people in Punta Gorda. There are some people in Corozal. All of them are people who are caught illegally entering the country.
You know, and you know, speaking of the economy, I did want to ask, you know, now that we are seeing things sort of open up, you know, little by little, how do we, you know, safely manage cases going forward when we know that persons are being allowed to move about more, their access to more businesses, and you know, we can only assume that people are having more contact with each other. So how, moving forward, is the ministry planning to safely manage, you know, the potential spread or potential new cases of COVID?
Well, you know, one of the issues we have also been asked in terms of opening up is why have we not opened up completely if you now have 5 weeks without a case? We have asked that this be done in a scaled, just like we scaled up in terms of the response, to scale it down in the same kind of fashion, because I don't know that we have learned the lesson completely. I now see people trying to do the physical distancing, people you know, wearing their masks, being more careful in that light. But we do want to scale it down in terms of where we are, simply because we need to be able to prepare for a new norm. If you have a case or a cluster of cases, then you're going to have to start doing what you were doing before, which means you start the gradual lockdown depending on where you find the cases. So the intention is people trying to educate as we go along, so that people are being able to grasp that concept that now we are working on the new norm.
And in relation to you know, testing of the general population as it is now, what sort of is the protocol or the policy for persons who perhaps, you know, maybe they may be experiencing symptoms, or is what sort of criteria is being used to manage and test the general population at this time?
Well, we are running tests right now at Tuesday, Thursdays, and Saturdays. Last week we did close to 150 tests. I believe is the final tally. What we are doing is we are testing all still frontline people. We are doing random sampling from across the country, and that's people who have more contact with the general public. We are testing everybody who has jumped the border, and we don't know how long they were there or how much contact they have had. Anybody who was having any acute influenza-like illness is being tested. And because dengue is now on the horizon, we have also determined to do random sampling of people who just show up with fever and classic signs and symptoms of dengue. So that's part of the expanded testing. In discussions with regional counterparts, it doesn't seem any country in the region is actually doing random sampling of people who are asymptomatic. So we are looking at that possibility because if they're saying that it's a low yield, that means you're going to be doing a lot of tests and you're probably not going to pick up any negative. So we are going to do that random sampling this week and look at it next week to see whether that is, if there's any value to it next week.
Now, so how many tests have you done on frontline workers so far? Those who weren't suspicious, but just part of the random sampling.
If you include health officials, it's going to be, that's a sizable amount, maybe about 500 people.
Okay. Have you been tested, Doc?
No, I have not.
Okay. Now, looking at, because I'm trying to understand, I hear what you're saying in not testing asymptomatic cases, but as, you know, all the information comes forward and we're learning more and more about COVID, but still definitely not enough, we do know that a substantial number of people may be asymptomatic. Let me ask you, do you think that it's possible that right now in Belize, there are asymptomatic persons passing on the new coronavirus to others?
It would not seem so, and I know that there's many unknowns, but
what makes you think
if
so?
it is the case, because we are not finding people who are ill showing up in the health system, and we are testing everybody who is ill. So if it is, in point of fact, what you're saying is happening, then we will have to be, I would say, a very lucky group of Belizean people that are not developing any sign or symptom. But I don't think that's happening right now. I am not seeing.
I think you've freeze. Yeah, you're freezing. Hello?
Yes, can you hear me now?
Okay. You were saying you don't think that there are currently any active cases perhaps moving around silently, since we do know it can be passed by asymptomatic persons.
Yeah, but then that would be testing everybody who's showing up ill, and none of them are turning out positive. That's one. We are not having a significant amount of people that are ill. So if that were the case, then that means that we have a cohort that is not developing any sign or symptom, and we will have to be extremely lucky for that to happen.
Okay. And looking at our current testing capacity, I know the numbers has always been a part of the conversations you have to have. How many tests do we have? How many we have that are going to be acquired so that we can be allow for a sustained testing over whatever amount of time it takes for us to beat the pandemic?
Hello?
Yes? Did you hear my question?
I couldn't hear what you were saying.
I was asking, what is the status in terms of the number of tests that can be administered at this time?
We at the last check, we were close to 6,000 tests that we could do. But that's also one of the reasons why our colleagues in the region, counterparts, were saying we have to be careful with just doing random sampling and you're not picking up anything, because the entire region still remains low in terms of their stocks supply for.
Yeah, we're having a lot of challenges with your connection at the moment. So you're saying that the stocks are low across the region. Have we placed an order? Are we awaiting further tests to come into country? Or we're just at 6,000?
No, we are expected to have up to about 12, 14,000 in terms of a total amount. But we still need to be careful, because if you start having a second or third wave, you need to have reagents for those possible scenarios.
But when is that expected to arrive?
Well, we have different delivery dates. Even some of the supplies beyond testing reagents are still coming in. Dates keep changing. We had some for the middle of May. Now it seems it's going to be for the middle of June. And that's why I think counterparts in the region are saying we have to be careful with how we go about doing the planning if we're not picking up anything with random sampling.
And I just want to go back very briefly to, to jump off of Marlene's last question, because one of the concerns, and I think you had raised this earlier in relation to specifically Mexico, is that when in several countries there's a concern about underreporting of cases, because there may be more cases of death, or perhaps more cases of things like pneumonia, and people have not been diagnosed. And I just wanted to clarify that you were saying that you were saying earlier that in our health system there's nothing to suggest that there's any sort of underreporting of cases based on the data that's coming out of the health system.
Yeah, because we are testing everybody who is, even if private sector sends any sample to those are being processed. But in the public health system, we are not finding people who are ill or who are dying of respiratory diseases. Then we are not seeing an unusual pattern of more deaths, if you will, because you would say, well, it affects other systems. So we are also not finding other diseases that people are showing up with that could explain any potential COVID-19 cases that we have not detected.
So looking at what we're seeing currently, I think one of the concerns is looking at the what allows for a person to be tested. Are we still using the protocol of persons who have respiratory illnesses alone, or are we also including some of the other symptoms that we have seen reported in other parts of the world, like the gastrointestinal type illnesses and other strange symptoms?
Yeah, not everybody who has gastrointestinal illnesses, yes, but some of those are being swabbed. Some people who are just showing up with fever and joint pain are being swabbed. People who are severely ill inside the public health system and are hospitalized are swabbed. Okay. We are moving towards testing people who are in ICU care, for example. So that becomes a representative sample, because those are random taking for testing, and we are not finding cases.
Okay. Now, what happens during this time? So you're doing random sampling. We were able to successfully contain the first wave of COVID-19. You said repeatedly that, we're not in the clear, we're not COVID-free, even though people very loosely use that term. But we should anticipate that there is the possibility, a very strong possibility, of a second wave. This also means that it's an important time for the ministry itself and the healthcare system to kind of regroup and assess and be able to make changes or enhance how we respond when and if there is a second wave. What is happening in terms of the planning for that?
Yeah, well, that's one. It's very important that you say that, because the changing dynamics of COVID-19 allows you to mandates that you go back and review your plan. So we are looking at having all the plans that we have tie up into one single plan, and making sure that continues to be socialized. I think the bigger challenge for us in health is opening up back the health system and now trying to deal with other diseases that are coming up. Chronic patients are starting to come back into the health facility, trying to work with an appointment system. Pregnant moms coming back into the health system, picking up the vaccination schedule, and dealing with a potential dengue outbreak, as we are expecting it to happen. Is how we're going to be able to manage all those other diseases amidst COVID-19. And I think that's the difficulty that we are having. We are, of course, reviewing surveillance plans, but not only for COVID-19, it's for the entire other spectrum of diseases that we routinely have. That's where the challenge is actually more than COVID-19 for now then.
So you're saying that it's a plan that will allow for being able to address whatever needs arise with COVID-19 and also be able to handle whether it's dengue cases or people who have complications based on their chronic conditions. We know a lot of people usually have babies later on in the year rather than the beginning. So these types of things are what you're trying to figure out how to co-manage.
Because people are coming back, and you might have been traditionally used to a specific form of our health system works, or all pregnant women would come on a given day, but now we're trying to find kind of like a ticketing system that will allow people to come back and not everybody at the same time. Same thing for chronic diseases. The spraying schedule will now start in terms of the dengue situation that's expected now with the rain starting to come in. But you can't forget COVID-19. And once you start having any other case of COVID-19, understand that some elements of the health system will need to continue to happen. And you still need to scale up your COVID-19 situation.
Do we still have designated flu clinics?
They still are functional, yes.
Yeah. And how are we doing in terms of reported cases of flu? Because the flu season usually ends about a month ago, no? March, April?
Towards the end of March, we are not having an increase in number of flu cases. We probably will keep them until the end of this month through the middle of next month. And then depending on how it goes, we go back to doing routine activities, whatever routine now, a new routine then, because it's not going to go back to being normal, and still being on the lookout for potential cases.
Well, you know that it's interesting that you say that, because I kind of wanted to get your view on sort of what generally you would say COVID-19, what sort of changes it's brought about in the healthcare system and the way that we manage these sort of things. Because as we know, we've seen, and I think when you were a guest previously, you had spoken about this in relation to how we've managed things like pink eye, and when knowing, of course, that we do have persons who are more vulnerable to different types of infections. Has COVID-19 brought about significant changes in the healthcare system, and do we expect those to be permanent?
Well, I think it's asking us to rethink how we will go about addressing the needs of the population. So, for one, we used to have maybe a diabetic clinic on a given day or a hypertensive clinic on a given day. We don't think that that's the way it's going to happen now. We are going to have an appointment system spread out throughout the day, spread out throughout the week. We do outreach through schools. Like, for example, we did a review yesterday with technical advisors. The dental health component, for example, is done routinely through schools in Belize City, but now there's no school, so you have to find a mechanism of delivering that message. Vaccination schedules that are done through school cycles, we have to find a way of getting them. For example, the HPV vaccine, which is done in standard for girls, we don't have access to the population now.
Yeah, because their second vaccine is due, right?
So all those things, you have to go back and rethink how those will be done. There's many other programs that we used to do, educational systems, NDAC, National Abuse Control Council, that does a lot of the education through the school programs. We'll have to get creative because it can be a new norm. So there's almost all layers of the work that we do are affected. Nutrition has elements that deals with the school system. It can't happen again, or at least not for now. And we also have to plan in tandem with new school cycles if and when that happens.
Yeah, and I want to come back to that just a bit later in the conversation and how you envision schools, what school will look like at the end of the year. But before that, I want to ask you, what is your assessment of how the team managed the first wave of COVID-19? And what would you say is going to be done differently or better when and if we face a second wave?
Well, I think there was a good work done from the public health standpoint. I think there was a significant amount of contact tracing done, and this is people who have done contact tracing for other diseases, be it malaria, elements in dengue, HIV. You can't forget HIV. Of course, every disease has a different dynamic, but I think it's classic public health that allowed the teams to do a rapid containment mechanism. That's one. Two is the response of the health system. It may have been delayed, if you will, in some aspects, but I think it's. I mean, we were all learning as we go along. So I think that will allow us to have a better response whenever there's a second wave.
So what
But you
what
also
I
can-
hear from you is that you're saying you think that the strength of our response to the first wave was in our public health, and especially in our contact tracing. So if that was the strength, what would you say would have been the weakness?
The weakness is trying to deal with a health system that was not entirely prepared, not because we didn't have the people, but because we were learning as we moved along. If you look at what we said in January, February, March, we were changing our plan because of what we were finding, even in terms of surveillance system. But it's not only what was done in public health. I think we have to take a look at two other layers, which is the response that we got from government and the oversight committee in saying, going ahead with all the lockdown measures that were instituted, but also the people's response. I think you can't deny the fact that people responded. You did not find people like other countries are doing, where people are saying open up, for example, or demanding that we open up. I think people were willing to abide, and you can't take that away from the overall response. So I think it's that three-pronged approach, which we did call for, where you said you need an all of community and all of government approach. I think that's what has worked in this regard. I think we are better prepared, and of course things are going to change as we move along. But I think we are as prepared as we can be. I don't know that I can say it in any other way.
You know, you mentioned something interesting, and it reminds me, I can't remember where I read it, but there was this particular point that was made, that when after the pandemic you don't see a large number of deaths or a crisis situation, one of the inclinations people may have is thinking, well, we did all of this for nothing because there wasn't a big issue that we had to deal with. When in fact, we did all of this, and so the result was only 18 cases. Are you, how do you move forward knowing that there will be a heavy level of skepticism in lockdowns and restricted movements if we do enter into a second wave, especially knowing now what the economic implications can be?
Well, I think we'll have to be able to balance with people what the implications are. I mean, we can give raw numbers in telling people, okay, this is the projected amount that we're going to have, projected amount of people that are going to die, and the potential cost it will bring. You would also see some people give some very raw projections elsewhere. We are saying people are going to die, and this is the amount of people that are expected to die. When you look at the US, for example, they are telling you this is the amount of people that we expect that will die as a result of what's going on. So once you're able to say that, then we hope that people can internalize that and make a decision in the Belize context. If I tell you, use dengue, then dengue killed 10 people last year. What happens if I tell you, if we don't do our part this year, you're going to have 10 deaths as a result? How much are we willing to sacrifice and invest to ensure that 10 people don't die? It's the same thing here. You can do projections for COVID-19 once you have a second wave and say, okay, this is a projected amount of people that will be in the hospital. This is a projected amount of people that will die as a result. And then you strike that balance. You doing something versus you.
Yeah. And the second part of my earlier question, in terms of what will be different in a response for a second wave, what is going to change now that we've had that first experience?
From the public health standpoint, I think for healthcare workers, it should minimize exposure, because we should be better prepared in terms of who you suspect is a COVID-19 case. And I think that's happening as we go along. So one of the elements in our favor is that we have had ample time to prepare. I think that's the potential thing that is going to change. Is our response should be quicker, much more structured, and even with people coming from outside, I think the ability to us to do it in a certain kind of way, allowing certain people to come in at a certain time period, allows you to have a better response. I think it's going to be much more structured, with less exposure to health staff. That's the way I'm seeing it. It will go now.
And do you feel comfortable that we're adequately equipped with what we need?
In terms of supplies, yes, and we continue to receive the PPE kits and everything, assuming that we're going to be having a second wave. There's a specific area in the offices in Belmopan that has been assigned just for storage of supplies and equipment.
And in terms of perhaps, the training of the personnel dealing with this, and we know we've received assistance from medical professionals from Cuba in managing this. But in addition to that, how about the actual persons the frontline responders and the training that they've gotten? Can you speak to us then, I guess, sort of about the level of training and preparedness that they're going to have for if there is a second wave?
Well, there is an online platform that was developed through the work with Dr. Hidalgo that I delivered close to 30 sessions every day, 1 hour and a half every day for doctors. There's a current session being done with Comesca for mental health responders. We are going to develop a mental health plan for healthcare workers and the community at large. We just got a platform also that's going to be in Spanish for people coming out of Spain, because most of the platforms are now online. We have moved towards the procurement of the support for online platforms. Those activities. We have Saudi Arabia to do online education, online continuous medical education. I'm not saying that that's the ideal. It's the ideal under the circumstances that we have. Understanding not everybody can participate, but that's as close as it can be for right now.
Yeah. And looking forward, we have two things that I wanted to touch on. One, let's talk about the potential reopening of specifically the airport, because it doesn't look like the land borders that would be something smart for us to do. But when and if foreigners are allowed to fly back into the country, from the health perspective, what are your thoughts on this and what will need to be done to keep Belizeans safe?
That's a question that has a changing answer, I would say, every day. We are in discussions with counterparts in the region because other Caribbean countries. So looking at that, I can't say that it's the same thing for Central America because most airports are now at least partially open for commercial flights. I know neighboring Cancun, for example, never really locked down the airport.
Yeah.
So for us, might be the ones in the region. I don't know if there is a straight answer because we are still looking at process flows, how potential arriving patients or passengers would be coming through the airport. We have had an initial discussion with BTB.
Have we acquired the rapid tests yet? Sorry to interject.
No, we don't. No, we don't have. But even if we have a rapid test, we still have to look at the process flow because how rapid will the result be? If you have a flight coming in of 180 people and you have to swab all of them, that's a delay already in terms of getting them through the airport. If anyone turns out positive, you have to send that sample for a confirmation to the central medical lab. Then does that mean you quarantine the entire plane until you have that result? Those are the kinds of questions that keep popping up. So even if you have on the horizon a rapid test, it's not going to be that easy. As I said, this is an evolving answer because we are looking at what other countries are doing. One of the ideas thrown out is that maybe people should be tested prior to them boarding a plane. Because when people go to an airport, you have 2-3 hours where you're waiting until you board the plane.
Yeah.
That might be part of the norm. And I think it's a question that comes up with civil aviation authorities, airlines in the region, because it's not going to be such an easy answer to say, okay, you have the rapid test, everybody can come, and this is what you're going to do.
Yeah.
We have to look for setting up health facilities now at the airport, at the border entry points. That's part of establishing new norms in as you start to think of opening up situations. I know that's a soft date given for July 1st, but I don't know. It's contingent on many other factors as well.
Okay, and lastly, schools are opening up around the world, and we're seeing a lot of changes there. We're seeing where sometimes kids are going to school on shifts. A lot of schools, some have moved their classes outdoors. There's a lot of focus on social distancing within the classroom. You know our reality here in Belize. What are your thoughts on when the children are allowed to go back to school, how the classroom will be different?
We had a preliminary discussion with Ministry of Education last Friday, and we're having one this Friday, where we tossed out the ideas of changing the school calendar, that notion of having 2 shifts, maybe going 9 to 12 without a break, and maybe 1 to 4 without a break, maybe concentrating on the more on certain kinds of topics, or going on in a certain week, Monday, Wednesday, Friday, and the following week go Tuesday, Thursday. All those ideas were thrown out. I don't know that we have a specific answer, understanding that maybe children have to wear maybe a face shield, not a mask, to prevent people from touching their face. Children, that is. All these things are being processed now with Ministry of Education as they come up with a plan. We told them that they need to also create a contingency plan in case you have a new wave coming in. Maybe the school year won't start in September. Maybe it needs to start earlier. If you're assuming you're going to have a second wave towards the end of the year. There are many ideas being thrown out. I don't think that there's a straight answer. For example, CSEC exams I know will be in July, August. So they need to prepare for that, and understand that we're going to be living under a new norm. Even the issue of the amount of people that come from across the border to schools in the Cayo area, that was initially discussed, because I don't know that will be able to happen. There's a lot of questions there that need an answer, I'm sure.
There's a lot of figuring out that has to be done. But in the meantime, yes, there are a few certainties that we do know, and that's how we prevent the spread of any infectious disease. Doctor, you want to close with kind of just what we need to keep on doing, remind ourselves how to protect ourselves and the rest of our family during this time, because we are not in the clear as it often feels.
Yeah, I think we have come a long way. We do have to give credit to everybody in that aspect. It's not only just what the Ministry of Health has done, it's what we have done as a community. Understand that physical distancing, the hand washing, those will remain, and that should be, if you want to call it a rehearsal for when a second wave comes, I think that's what we want to ensure that people get the message, is that we change our behavior for whenever we get any new cases.
Okay. Thank you very much, Dr. Manzanero.
Thanks for the invitation.
All right. And with that, we are going to take a break. And one of the things, Gavin, we talked about quite a bit just now is adjusting to what the new norm is. So we're going to have a conversation with an anthropologist from Galen University, talking about what the new norm is, how we interpret it, and just the shifts that take place in this pandemic. So that's coming up in a few. Please stay tuned.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.